Hi, my name is Georgia Warmbein, and this is my honors option project for Chemistry 251. I will be discussing vitamin A and its organic properties. In this video, I will explain what vitamin A is, including its structure and properties. Also, I will talk about what vitamin A does in the body and its pharmacological importance. Retinol is a common name for vitamin A. Throughout this video, I will refer to it by both terms. Vitamin A is an essential micronutrient in the human body. It cannot be synthesized in the body, so we must absorb it from the environment. One important use of vitamin A is in the retina of the eye to form light-absorbing molecules used for vision of color and vision in low light. Additionally, vitamin A is involved in general growth, reproduction, and differentiation of epithelial cells. Epithelial cells are the cells that line the outer layer of the skin, the surface of body cavities, and the lumen of fluid-filled organs, such as the gut or intestine. Vitamin A is required for healthy skin and bones, and deficiency of it is a cause of child mortality. Vitamin A is an organic compound, meaning it is mostly composed of carbon. The chemical formula for vitamin A is C20H30O. On the left is the Lewis structure for it, and on the right is a skeletal structure. Retinol is an orangish-yellow color. This is due to the energy gap between its molecular orbitals. When visible light shines on retinol, some light is absorbed and its electrons become excited, causing them to move up in energy level. The remaining light is reflected, and that gives it its color. The wavelength of the reflected light is approximately 560 to 590 nanometers. Because retinol is a nonpolar molecule, it is practically insoluble in water and glycerol. It is soluble in alcohols, fats, and oils. This is why retinol is a fat-soluble vitamin in the human body. In fact, body fat is often yellow due to the vitamin A in it. Like I said earlier, vitamin A cannot be synthesized in the human body, so we must absorb it from the environment. Most commonly, it is ingested from our diet. Pictured are some, but not all of the foods vitamin A is found in, including liver, egg yolk, oily fish, cantaloupe, dark green leafy vegetables, herbs, apricots, and pumpkin. The process of synthesizing retinol in a lab is extremely complex and difficult to understand, so I think it is more relevant to discuss how the body digests and converts retinol. After ingestion, retinol is absorbed in the small intestine and incorporated into the liver in the ester formed and stored in hepatocytes. Esterification is the process of reacting an acid with alcohol to produce an ester and water. When needed, it is deesterified, attaches to retinol-binding protein, and is transported to the appropriate tissue. It is then moved intracellularly via cellular retinoic acid-binding protein. From there, retinol can be converted into retinyl esters, retinal, and retinoic acid. This slide shows some other forms of retinol. Retinoic acid is a biological active form of vitamin A. Retinol, or forms of it, is an active ingredient in many pharmaceuticals. I became interested in vitamin A because it is an ingredient in a topical facial cream I am prescribed, tretinoin. Tretinoin contains a synthetic vitamin A derivative. These derivatives are commonly called retinoids. The first generation retinoids include two monoaromatic forms, tretinoin and isotretinoin. Tretinoin is an all-trans retinoic acid form of vitamin A and commonly used for the treatment of acne vulgaris. It is also used to reduce rhytids and photoaging. An oral form of the drug has been used to treat various bone marrow cancers and neuroblastoma. Isotretinoin is so effective that it can be life-changing for some patients. It is used to treat severe cystic scarring acne and is used worldwide. Most pharmaceuticals that have retinoids help by reducing acne. That's why I use it, and enhance the overall appearance of the skin.